Part 1. Introduction and the alarming statistics. What if I told you that someone born in 1990 has quadrupled the risk of developing rectal cancer compared to someone born in 1950? Would that change how you think about your health today? Welcome, dear listeners, to today's essential discussion about a health crisis that's been hiding in plain sight. I'm your host, and I want to extend my heartfelt gratitude to each and every one of you who has subscribed to our podcast, shared our episodes with friends and family, and taken the time to leave thoughtful comments. Your support makes these important conversations possible, and it means the world to us. Today, we're diving deep into a topic that affects 1 in 25 people, yet remains shrouded in cultural silence and medical mystery. We're talking about colorectal cancer, a disease that has quietly become the 3rd most common cancer in both men and women, and the 2nd leading cause of cancer death when you combine both genders, trailing only behind lung cancer. But here's what should truly concern all of us. This isn't just an older person's disease anymore. 20% of colorectal cancer diagnoses now occur in people under 50 years old. Let me repeat that. 1 in 5 people diagnosed with this potentially deadly disease are under 50. And if you're a man under 50, colorectal cancer is actually the leading cause of cancer-related death in your demographic. The statistics become even staggering when we look ahead. By 2030, that's less than 5 years from now. Colorectal cancer is expected to surpass breast cancer as the leading cause of cancer death in young women. Despite these alarming trends, we're simply not talking about this disease with the urgency it deserves. Dr. Kimmy Nong, co-director of the Colon and Rectal Cancer Center at the Dana-Farber Cancer Institute in Boston, has been studying this phenomenon extensively. According to her research, since the mid-1990s, we've witnessed a consistent 2 to 3% increase annually in both colon and rectal cancers among people under 50. This isn't a statistical blip, it's a sustained, troubling trend that demands our immediate attention. What makes the situation particularly perplexing is that many of the young patients Dr. Nong treats don't fit the traditional risk profile. They're not obese, they maintain active lifestyles, and they follow healthy eating habits. This suggests that something else entirely is driving this epidemic, something we haven't fully identified yet.
Part 2. The hidden causes and cultural barriers. So, what's behind this mysterious surge in colorectal cancer among younger generations? The answer, unfortunately, isn't straightforward, but the clues are deeply concerning. Dr. Nang's research reveals what scientists call a birth cohort effect, meaning the increase in cancer rates varies and travels by generation. This pattern strongly suggests that recent environmental exposures are the likely culprits. When we say environmental factors, we're talking about changes in diet, lifestyle, and exposure to novel environmental toxins and pollutants that previous generations didn't encounter. One particularly concerning possibility that researchers are investigating is microplastics. While we're still learning about their effects on human health, it's entirely conceivable that these ubiquitous particles may play a role in the rising cancer rates we're seeing. The reality is that our generation and those that follow are living in an environment fundamentally different than that of our parents and grandparents. But identifying the cause is only part of the challenge. Perhaps even more troubling is how cultural taboos and societal discomfort are preventing us from addressing this crisis effectively. This brings us to one of the most insidious aspects of colorectal cancer, the shame and embarrassment that surrounds it. Writer and colorectal cancer survivor Lori Abraham experienced this firsthand. When she was diagnosed, she found herself imagining that people pictured her sitting on the toilet when she mentioned her cancer. This visceral discomfort around anything related to bowel functions creates a dangerous silence around a disease that desperately needs open discussion. The impact of this cultural squeamishness extends far beyond individual embarrassment. It affects medical terminology, funding decisions, and even how patients seek help. For years, medical organizations and support groups referred to this disease simply as colon cancer, despite the fact that 30% of cases are actually rectal cancer. They avoided using the word rectal because they believed it would make people less receptive to prevention messages. This linguistic dance had real consequences. People would call the American Cancer Society asking, "Your website mentions colon cancer. Does that apply to me? I have rectal cancer." Patients couldn't even see themselves reflected in the health information available to them because of marketing strategies designed to make the disease seem less uncomfortable to discuss. The funding disparities tell an even more troubling story. Despite being deadlier than breast cancer, colorectal cancer receives approximately half the research funding that breast cancer does. This isn't because breast cancer isn't important, it absolutely is, but it highlights how cultural comfort levels directly impact medical research priorities and ultimately patient outcomes. Gender dynamics add another layer of complexity to this issue. Colorectal cancer is sometimes casually referred to in medical circles as an old white man's disease, despite the fact that the gender gap in diagnosis isn't actually that significant. Women get this disease almost as frequently as men do. Yet many women report feeling that having colorectal cancer somehow seems unfeminine. For men, different cultural barriers emerge. Research shows that men who strongly value being perceived as strong are 54% less likely to complete colorectal cancer screening. The association of screening procedures with vulnerability or invasion of personal space creates a powerful psychological barrier to potentially life-saving medical care.
Part 3. Recognizing symptoms and overcoming diagnostic delays. Understanding the symptoms of colorectal cancer could literally save your life or the life of someone you love. Yet these very symptoms are the ones people find most difficult to discuss, leading to dangerous delays in diagnosis. The most common symptoms, particularly in younger people, include blood in the stool, changes in bowel habits, and changes in stool caliber, such as stools becoming pencil thin. These symptoms are so uncomfortable to talk about that patients sometimes don't even mention them to family members, let alone healthcare providers. Dr. NG emphasizes that this reluctance to discuss symptoms leads to significant diagnostic delays, especially in younger patients who often attribute these changes to less serious conditions. And here's the challenge that healthcare providers face. These symptoms can indeed be caused by benign conditions like hemorrhoids. In a young, otherwise healthy person, blood in the stool is more commonly due to hemorrhoids than cancer. However, this is precisely why ongoing dialogue with healthcare providers is crucial. Symptoms that don't resolve or that worsen over time need proper medical evaluation. The key is persistence and honest communication with your doctor about changes in your body, no matter how embarrassing they might seem. One of the most tragic aspects of this disease is how family history can be obscured by the same cultural shame that prevents people from seeking timely care. Dr. NG has treated patients who discovered only after their own diagnosis that other family members had battled colorectal cancer in secret. This silence can be deadly, because having a family history of colorectal cancer allows you to begin screening earlier than the standard recommended age of 45. The screening guideline is clear. If you have a first-degree relative who had colorectal cancer, you should begin screening 10 years before the age at which they were first diagnosed. This early screening can be truly life-saving. It can prevent cancer from developing or catch it in its earliest, most treatable stages. But this prevention strategy only works if families are willing to have honest conversations about their medical histories. The importance of these family discussions cannot be overstated. We're not just talking about personal health decisions, we're talking about potentially life-saving information that could benefit multiple generations of a family. Breaking the silence around colorectal cancer isn't just about reducing stigma. It's about creating a chain of protection that could save lives for decades to come. Healthcare providers are also recognizing their role in breaking down these communication barriers.
Dr. NG advocates for doctors to routinely and systematically ask patients about colorectal symptoms at every visit rather than waiting for patients to bring up these uncomfortable topics themselves. Simple questions like, "Have you noticed any blood in your stool?" should become as routine as asking about blood pressure or weight.
Part 4. Disparities, Access Challenges, and the Path Forward. As we examine the landscape of colorectal cancer in America, we uncover disturbing disparities that reflect broader inequalities in our healthcare system. For years, it has been documented that Black Americans have 20% higher rates of colorectal cancer incidence and are 40% more likely to die from the disease compared to non-Hispanic whites. The reasons behind these disparities are multifaceted and not yet fully understood, but access to screening and high-quality care plays a significant role. However, the current trends in young-onset colorectal cancer are adding new complexity to this picture. Paradoxically, while colorectal cancer rates are increasing across all racial and ethnic groups, the steepest increases are actually occurring among non-Hispanic whites. This demographic shift is having an unexpected effect on traditional health disparities. Some of the gaps between racial groups are actually narrowing, not because outcomes are improving for historically disadvantaged populations, but because younger people of all backgrounds may actually have worse survival rates than older patients with the same disease. This suggests that colorectal cancer in younger people might be more aggressive than the same disease in older populations. The access challenges extend beyond racial disparities to include age-related barriers that affect people across all demographics. Even though the recommended screening age has been lowered from 50 to 45, the steepest rates of increase are occurring in people in their 20s and 30s, individuals who still don't qualify for routine screening under current guidelines. The story of delayed diagnosis due to insurance and access barriers is heartbreakingly common. Uninsured individuals often delay seeking care until their symptoms become severe, sometimes arriving at emergency rooms only when their cancer has progressed beyond effective treatment. These delays can transform a potentially curable disease into a terminal diagnosis. The challenge of lowering the screening age further is complex. While it might seem logical to screen even younger people given the rising rates, healthcare policy must balance individual benefit with population-level cost-effectiveness. Screening procedures, while generally safe, do carry risks and complications. And despite the alarming percentage increases in young-onset colorectal cancer, the absolute numbers remain relatively low compared to older age groups. So where does this leave us? How do we move forward in addressing this growing health crisis? The path forward requires a multi-pronged approach that addresses both the medical mysteries and the cultural barriers we've discussed. First, we desperately need continued research to identify the environmental and lifestyle factors driving the increase in young-onset colorectal cancer. Understanding these causes could help us identify high-risk individuals who would benefit from earlier screening, even in their 20s and 30s. Second, we must continue the difficult but essential work of breaking down cultural taboos around digestive health and colorectal cancer. This means healthcare providers need to normalize conversations about bowel health, families need to share their medical histories openly, and society needs to discuss this disease with the same urgency and attention we give to other major health threats. Third, we need systemic changes to improve access to screening and care, particularly for younger adults and underserved communities. This includes insurance policy changes, expanded community health programs, and innovative approaches to early detection that might be more accessible and less invasive than traditional methods. The encouraging news is that when colorectal cancer is caught early, it's highly treatable. Screening saves lives. It's that simple. The challenge is ensuring that everyone who needs screening can access it, and that everyone who experiences symptoms feels comfortable seeking help promptly. Each of us has a role to play in addressing this crisis. We can start by having honest conversations with our families about medical history. We can advocate for ourselves and our loved ones when symptoms arise. We can support research and policy changes that improve access to care. And we can work to normalize discussions about digestive health in our communities. The rising rates of colorectal cancer in young people represent one of the most significant emerging health challenges of our time. But with awareness, action, and advocacy, we can change the trajectory of this disease. The lives we save might include our own. Thank you so much for joining us for this crucial conversation about colorectal cancer. If today's discussion has resonated with you, I encourage you to subscribe to our podcast so you never miss an episode that could impact your health and well-being. Please share this episode with friends and family. These conversations save lives, and your voice can help break the silence around this important health issue. I'd love to hear your thoughts and experiences in the comments. Your engagement helps us create content that truly serves our community's needs. Together, we can raise awareness about health issues that matter most. Before we close, I want to provide an important disclaimer. The information shared in today's episode is for educational purposes only and should never be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing symptoms or have concerns about your health, please consult with qualified healthcare providers who can provide personalized medical guidance based on your individual circumstances. Until next time, take care of yourselves and each other. Thank you for listening.